you all. Thank you for joining us today. So I'm going to get us started just in the interest of time. I'm sure more folks will join as we keep going with our hour together. But welcome to the CIN webinar, Developing a Learning Community to Advance Care Management. In this conversation today, you'll get a chance to learn from our CIN partner Community Health Center Network on how they've successfully completed the first pilot cohort of their peer learning and professional development program, the Care Management Learning Community for care managers and care coordinator professionals. So before we dive into the content, I just want to take a moment to introduce CIN for those who are not familiar. My name is Marie Hubbard, and I'm the program manager for the California Improvement Network, also known as CIN. I will use CIN because California Improvement Network feels like a mouthful compared to CIN. CIN is a learning and action network that aims to advance the Quadruple Aim by spreading better ideas for care delivery. CIN is truly fueled by the energy and innovations of our partners and our member organizations. CIN is a project of the California Healthcare Foundation and managed by Health Force Center at UCSF. We welcome you to visit our websites to learn more about both of our organizations. A few quick Zoom tips before we get started. I know everybody is Zoom wizards by now, but for those of you who may be new, please, we welcome conversations through chat. So if you have questions, want to share a comment, we welcome you to do that. Everybody will be on mute for the remainder of this hour. We will be recording this webinar. If you're having any difficulties, I welcome you to direct message my colleague, Christina Travalos, and she can help troubleshoot with you. But please do use the chat as a way to communicate with us at the program office and our presenters. So with that, I have the privilege of introducing our two speakers today, Selena Gupte from Integrated Health Consultant, Integrative Health Practitioner, and Behavioral Health Coach, and Jana Cantor is Learning and Development Manager at Community Health Center Network. So with that, I will pass it off to our speakers to get us started.
Thank you, Marie. And there we go. We'll be sharing those slides. Good afternoon, everybody. Welcome. We're going to spend the lunch hour today talking about the care management learning community and how we leveraged care manager expertise to improve whole person care. Next slide. And Marie quickly introduced us, and we want to just share a little bit, a fun fact about ourselves and tell you a little bit about the organization that we work with. So I work at Community Health Center Network, which is a Medi-Cal managed care organization that does business administrative supportive services for a consortium of 8 FQHCs in the Bay Area. And a fun fact about myself is that I am a beginning rock climber and have been spending as much time as I can at the rock climbing gym the past 2 months. So if anybody here rock climbs or can give me any tips, I am all ready for it. I have a lot to learn and I'm just having a great time trying to learn as much as I can and get as strong as I can. Selena?
Hello, everyone, and it's so great to be with you today. I am Selena Gupte, and before I transitioned into the consultant role that I am now and worked on this amazing program that you're going to hear about, I was with the Alameda Health Consortium, which is a sister agency to CHCN, and that's the side that engages in program development, policy, and advocacy. And a fun fact about me is that I'm an emerging astrologer. So I have been fascinated by all the things that are above us, the sun, the moon, the planets, since a young age. And really recently taking a closer look at the meaning of the planets and their alignment with our patterns and experiences here. So if any of you are interested in talking about that more, I would love to hear from you as well. So thank you so much for being here, and I'll pass it back to Jana.
Okay, next slide. Let's see. All right. So we're planting the seeds this afternoon to hopefully inspire you to invest in programs that strengthen the skill set of care managers and other allied health professionals. We see immense potential in them and believe they are the future leaders at our health centers and within the healthcare system. And we hope that you can connect the dots between their professional development and a workforce that shows increased confidence, resilience, and retention. Next slide. In this webinar, we're going to cover the development of the CMLC, which is the acronym for Care Management Learning Community, and 4 letters that you're going to hear quite often this morning. And we're going to dive into the key features that set it apart from other traditional training programs. We're also going to present findings from session and program evaluations. And we're going to end with an activity that has you thinking about who could benefit from a program like the CMLC, and have you imagine a healthcare system where we do invest more in our workforce, and especially in our care managers. Next slide. So in this first section, we're going to present the background and development of the program, showcasing how the CMLC went from an idea into something that we're offering on a regular basis. Next slide. So before the CMLC was a program that's almost finished with its second cohort, it was an idea founded on the understanding that community health workers and other client provider liaison roles were essential in member care. And this understanding that just by offering some more training and support to them, you'd polish off these gems, and this would lead to improved patient care. Lifelong Medical Care, which is one of our member health centers, reached out to Selena to create a leadership program for CHWs back in 2017. And when I came on board at CHCN, Selena and I started collaborating to develop a scaffolding for this type of training program. We selected the content we wanted to cover, we wrote objectives, we created agendas, and we envisioned an in-person multi-day program. So the pilot light was already burning when our colleagues found a California Improvement Network QI grant that could help us turn the oven on and get this program off the ground. Next slide. And once the oven light was on, we got to work. So we applied for the grant in the middle of March 2020, and I think all of us can remember what the middle of March 2020 was like. And while we applied for the grant, we thought we'd be meeting in person by the time the program started. What turned out to happen was quite different. And so the development, implementation, and 2 rounds of this program have been done completely digitally, shifting some of our original ideas that we had back in 2018 to best fit a digital delivery platform. And with regards to participants, we wanted a wide variety of care managers in the role. So we cast a net to really capture the breadth of care manager, allied health professional, and paraprofessional role that we believed could benefit from this program. Further, we knew it was a big ask to hold a regular multi-hour training for care managers during the pandemic. So nailing the logistics, such as the duration of the sessions, how many sessions we would offer, people's capacity for enrichment activities, along with choosing content that really spoke to the needs of our participants was key. We used human-centered design to develop surveys and focus groups for our future participants and their supervisors, asking them for feedback on all aspects of the program, which we combed through to land on the final content and structure. We settled on 6 bi-weekly 2-hour sessions over the course of 3 months, based on their guidance. Then we developed the CMLC's main objectives, committing to key features we believed would make learning stick. And finally, we opened up the registration to that wide net of care managers, collaborating with our colleagues who worked with specific teams to get buy-in and to pass along the word. And when we had twice as many applications for the number of positions, we knew we were onto something. Next slide. These are our 8 member health centers, all based in Alameda County, with extended services to surrounding counties, Solano County, San Francisco, and Contra Costa. And they serve more than 270,000 people across 95 sites of care. In addition to primary care, women's health and family medicine, they also offer mental and behavioral health, dental health, and preventative care services. And participants from both cohorts, we had 33 participants in the first cohort and 26 in our current cohort, had titles that fell under that allied health and paraprofessional role, such as HIV PrEP navigator, integrated behavioral health care coordinator, community health worker, and wellness coach. And many of our participants worked with patients with complex needs. And they really were looking for tools that would help them improve their care and case management skills, establish and maintain better boundaries, and manage stress. Next slide. When we designed the program, we wanted to do more than transfer knowledge to our participants. We wanted to create a space where they learned from each other and went to each other for workflow ideas and support. And we saw the CMLC participants as emerging leaders and believed that sharing tools, which would encourage them to honor their limitations while also engaging in personal practices that could help them sustain their work long-term, would prepare them for a future in leadership roles. And we also hoped that an investment in their professional development through training and coaching would reconnect them with their purpose for doing this work in the first place. Next slide. So this is an overview of the content from the CMLC. So we start with a bird's eye view of the healthcare system that addressed structural determinants of health. And in the second session, we go into two of our most requested topics, which is time and case management. In our third and fourth sessions, we look at the role that relationships play in our participants' work. First, by taking a look at the relationship between our participants and their clients, and then taking a look at the relationship between our participants and their peers and supervisors. And we used evidence-based practices like empathic communication and motivational interviewing, harm reduction, and de-escalation to take a look at those relationships and improve communication. In our fifth session, we covered housing, specifically what our participants could do to help patients navigate the housing system from their roles, which are outside housing. And then we finished with a session on boundary setting and self-care and stress mitigation, really taking a deep look into boundary setting because that is a topic that came up throughout our coaching sessions. We had an optional seventh session in which participants shared their final projects, which Selena will talk more about those final projects when she presents on the key features, and also had an opportunity to reflect on the program. Next slide, please. And so here are the key features of our program. So first, and I believe most important and unique to this program, is a one-on-one coaching offering that we offered. Then the next key feature was infusion of interactive activities like you'll experience later and opportunities for peer learning in all of our sessions. Another key feature was a framing of trauma-informed and strength-based lens into each of our sessions. And we also centered on personal resilience. We incorporated structural determinants of health and health equity into our sessions as well, returning to the idea that there are many factors outside of our participants' control that impact member health. And finally, we provided enrichment resources to enhance the content we covered in each session so that participants had an opportunity to dive more deeply into topics on their own time. So I'm going to pass the mic over to Selena, who's going to dive into each of these key features a little bit more.
Okay, great, Jana. Thank you so much for setting this next section up so beautifully. If you will go to, great, next slide, it's perfect. So in this section, we are going to dive into more of those key and fundamental features. Actually, if you'll go back up one more slide. And these are features that we believe set the content apart from the standard professional development programs or even new hire programs. Our intent was to bring forth key topics, skills, practices that really enhance the role of care managers, support their development, offer topics to expand their skill set, and really hopefully take them to the next level within their own professional and career development. So next slide, please. So the biggest highlight of our program was to offer individual coaching sessions. And as was shared, this series was laid out with progressive skill development and topics. The goal and role of coaching was to add an additional layer of support for participants to bring forth areas that they were interested in discussing more, or expanding on what they were learning, or even practice a skill set with one of us as a coach. So what is coaching? Well, there are many types of coaching that are out there. And within the CMLC program, we defined coaching to be a collaborative conversation about unique goals and strengths with the potential for mentoring on skills to enhance professional development. So essentially, the elements of coaching are things like refraining from being an expert, to be in collaboration with and to co-create with another person, to build relationships of trust and rapport, to carry the belief in another's capacities, honoring people as experts, and approaching from a non-judgmental stance. So in the role of care manager, these professionals are actually engaging in coaching every day to encourage healthy choices and access to resources. And so we essentially modeled the process for them and with them. So how did we do it? How did we do coaching? Well, we offered each participant to sign up for one hour individual coaching session with one of us. It was an open first come, first serve process. And actually what we found is that most slots were filled up super quickly. And it also became clear that one session was actually not enough. So because there was an additional interest in these conversations, we ended up opening more coaching sessions. And really this demonstrates the value of holding time aside from the group learning process to address those lingering questions, needs, personalizing skill development processes, and especially for supporting the path of building confidence levels in their roles, which I'll touch base on a little later as well. The topics that we talked about in coaching review went from a variety of things. They were inclusive of things like reviewing a skill from a previous session, or thinking through ideas for future education or desires for future job placements. One example that crossed both of our paths was that of establishing and verbalizing the need for firm boundaries around work-life balance, or even with colleagues and supervisors. So we practiced and role modeled what a conversation would look like, and so that our care managers felt prepared enough to actualize these conversations. Next slide, please. A second key feature that was really an intent from the outset of the creation of this program was hosting a platform by which people who work in similar roles across our network could see each other and get a chance to know each other. It was almost like saying, wow, there's someone else out there like me who is doing similar work and experiencing challenges. Too often, the many unique roles at our clinics work in isolation, even if they're in one organization. And with that, they may not even necessarily be aware of others like them that exist across the system of care, which is always helpful for anyone to know that they're not alone in doing the work that they do. So things that we incorporated to support the concepts of peer practice and cohort development were a fun getting to know each other bio, which was compiled into a welcome booklet for everyone to read prior to their first session. So we asked questions like, who are a few people you'd have over for dinner? Or what was a favorite family or cultural tradition? Or if you could instantly become an expert in anything, what would that be? These set the learning process to be fun, engaging, relaxing, interactive, and again, cohort driven. We also incorporated digital engagement strategies with lots of breakout sessions, case scenarios, and discussions, and you'll get a sense of one of those strategies towards the end of our time together. We encouraged all of our participants to be super creative with their final projects, and while these weren't projects per se, they were more of an opportunity for participants to take what inspired them and design something that speaks to them. And we encouraged our participants to partner up with people in different clinics or health organizations. So as mentioned, an intention throughout our program was cross-organizational partnering and collaboration. So all of the peer practice opportunities were set up in these pairings or small groups with someone that you may not actually work with every day. Next slide, please. A third key feature that was a true emphasis in our program was that on trauma sensitivity and responsiveness. In our system, we are very well aware that care managers interface with patients from marginalized communities and often those with the most complex care needs. So emphasizing the trauma lens throughout our time was critical, specifically the compassionate understanding that trauma is pervasive and often is what may be underlying behavioral patterns and health conditions. In our network, some care managers may have access to other training opportunities on the foundations of trauma-informed care. So for this program, the skills development opportunity was beyond knowing the foundations. How do you interface with individuals with a traumatic background? How do you become a responsive communicator? What are techniques that are helpful? And how do you apply those when needed? In that realm, we brought in case studies, activities, discussions covering empathic communication, holding presence, harm reduction while also emphasizing one's own boundaries, and the concepts behind nonviolent communication, all as a modeling for embodying a sense of compassion and empathy. Next slide, please. But generally in public health and healthcare, there is an emphasis on problem solving. And our public systems and healthcare settings tend to be set up that way, which is to see a problem happening and then become reactive to that or create an action to change that. And while that's one way of addressing change, what I learned in becoming a holistic health coach is that working from a strengths-based orientation shifts all of that to one of empowerment and gives attention to skills that enable people to flourish, feel engaged and fulfilled. So another key feature of our program was to enter into all aspects from an affirming and positive stance. That meant throughout the process, we honored the expertise and knowledge of our care management community as leaders and experts themselves, lifting and co-creating what was important to them and emphasizing this cohort of peer leadership, aligning with their goals and in coaching sessions, working towards those goals one step at a time. In these ways, we affirm and support the capacities for building confidence level in their roles to really thrive as integral members of a care team. Because quite frankly, within the hierarchy of the health setting, there is a power differential which affects confidence. So we emphasized primary professional growth needs intentionally. Things like acquiring new skills, applying and appreciating strengths, fostering capacity and self-efficacy, and growing confidence. Next slide, please. So much of what our care managers do is to show up authentically for patients, and they often put their own needs aside. And with that being done over and over and over again, we certainly have seen, especially in recent years, the overwhelming burnout in the industry as frontline professionals. A care manager's energy also needs to center on oneself. We call this centering into personal resilience, or said in another way, a true elevation of self-care. Personal resilience was interweaved throughout our sessions. One way was through exercises on managing time and energy. For example, we asked participants to organize their days with each other and share the why on how they organized their time the way they did. And then to think through, how would you reshift everything if there was an emergency or a last minute need? How would you redefine priorities and still manage your time and, more importantly, your own energy? We had conversations on work-life balance, especially with all the transitions with COVID-19, shelter in place, working virtually. How do we prioritize ourselves, create and maintain personal limits, and make sure that work doesn't eat into our personal time? And we also dedicated a full session on personal care and resilience wellness practices, such as self-awareness, slowing down, mindfulness, exercises to identify one's own self-priorities and goals. And later on, you'll hear about a few projects that were inspired from this messaging and how one of the CMLC program outcomes was actually a reduction in the feelings of burnout. Next slide, please. So at this point, I think we can say that the whole system is engaged in how to address social determinants of health and health equity. Care managers are the professionals in the system that are actually doing this upstream work. They do this by assessing basic needs, connecting people to resources, guiding and navigating through the system, and checking on individuals regularly. They do such incredible work without always knowing how their roles are part of a larger system and how the movement towards addressing social determinants of health and health equities play a large part of their role. Therefore, we highlighted the socio-ecological model and asked them to voice how their work interfaces. We also knew early on in the development of this program that one area of overwhelming need was that of housing, or at least understanding how housing is connected to the work that they do. And quite frankly, our care managers are not housing experts, although they often are asked to figure out this super complicated area. So we brought in experts to share updates, which are ever changing, along with addressing outstanding questions on how best to support clients. Behavioral health is also often considered a separate entity in itself, and we had an intentional focus and discussions on how care managers are crucial to understanding this intersection of behavioral health and care coordination and basic wellness assistance in that realm, essentially bridging the silos of physical and behavioral health to support seamless integrated care. Next slide, please. All right, and a final key feature that we would like to highlight was hosting a resource library. This is intended as a living and ongoing dynamic resource for all participants in CMLC, now and in the future. We populate a Google Drive organized by sessions with readings, videos, tools, assessments, links to resources and organizations, and more. And before each session, participants are informed of what's in that drive so that they can glance through recommended pre-readings by session. Next slide. In rounding out the key features of our CMLC program, it's paramount to say how valuable this cohort of professionals are and that they truly are an untapped resource. Through setting up this program and definitely while coaching these amazing individuals, each of them carry inherent gifts and are ready to shine. Many of these individuals come with lived experiences and into the roles with a range of skills already ripe to apply. And the misperception is that they might be new or green to the work, which is often not the case. In fact, these individuals already embody that human-centered, relational, interpersonal, and humanistic mindset of what it means to really support, understand, empathize, and hold compassion. Finally, these are our future leaders and game changers. As they are integral members of the team, being open to the promotion potential of these leaders and programs like this one can help enhance their skill sets and prompt them to the next level for advanced roles in the industry. Next slide, please. We wanted to end this section by sharing some of the final projects that came out of the first cohort. Again, these projects were not necessarily projects as much as they were opportunities for participants to share what stood out for them, inspired them, motivated them, and in some cases, how they thought they could apply the material or skills into their work. We also invited everyone to be super creative. This wasn't about writing a paper. This was about sharing what spoke to you and describing that in your own words to your peers. So among the range of projects we got were, your standard PowerPoint presentations, also creating one's own trainings, making videos or recordings, applying the skills. And some were inspired to express through art and drawings. And so these are two examples that you see on your screen. The drawing on the left is from a participant who created a house of self-care. The path and the doorway leading up to it are things that no longer serve them and that they're wanting to leave behind. And the windows of the house are their valued domains of self-care. And the artwork on the right is from a participant whose goal of being a therapist was realized through this program. She painted an image of what it would look like to guide someone through breath work and stress reduction strategies. So we hope that by walking through the key features of the CMLC program, this helps with understanding the depth of what this program was about and the content that we covered, and especially the flavor of how programs like this one can support a different set of skills among your care management team members. We're going to pause here for a moment because we've gone through quite a bit of information, and we certainly want to entertain any questions, comments, feedback that have come up as we've laid out our information so far. So I believe you might be able to put questions into the chat feature and or unmute yourself. Oh, add to the chat. Thank you, Marie. All right.
Looks like we did get a question in the chat. So happy to just read it out loud from Laura. Have you looked at impact on PCPs, primary care?
Yeah, really good question. And thank you for bringing that up. We'll see our evaluation results in just a few moments. And we were concerned mostly with the evaluation of the program and the takeaways for the participants themselves. However, you bring up a good point, which is to cast a broader net of how this impacts other team members as well. So that is potentially something we can certainly bring into the future.
It also makes me think of the activity that we'll do shortly, where we think about who could benefit from programs like this as well.
Absolutely.
We'll move on to the next section, and we'll have time at the end for any more questions that may come up as well. Selena, thank you for walking us through those key features and for continuing to paint the picture of the program for us.
Thank you.
Okay, so we collected feedback throughout the program so we could alter our offerings, our timing, and our structure based on what our participants were requesting. We created pre and post program evaluations that assessed on a variety of factors. And we also had evaluations following each session as well. And we'll share some of our findings from these evaluations in this section. Next slide, please. So this slide shows how participants rated their knowledge on a 4-point scale for each topic that we offered in the CMLC. So the information that you're going to see within that turquoise rectangle highlights that the majority of our participants who completed the survey felt at least knowledgeable about each topic, or they rated themselves as a minimal of 3 out of 4 on the knowledge scale for each topic, with most of them rating their knowledge level as very knowledgeable. In fact, 93% of our participants rated themselves as knowledgeable or very knowledgeable in 9 of the 13 topics presented. And the following topics had 100% of our respondents rate themselves as knowledgeable or very knowledgeable: empathic communication, case management, de-escalation, and mindful conversations. And we also saw gains in knowledge across the board from pre to post program evaluations. Next slide. The CMLC's participants consistently face many challenges in their roles, challenges that have only been exacerbated by the pandemic. The first CMLC occurred in the winter of 2021 when another COVID-19 wave was disproportionately impacting the patients that our participants served, bringing even more challenges to them, many of whom were schooling their children. Yet almost 70% of survey respondents felt they could confidently face the challenges after completing the CMLC. None said they lacked confidence. These numbers align with what research consistently shows, which is that organizational investments into professional development increase worker confidence. And we're all aware that these challenges are not going away and may in fact worsen over time. A confident, highly skilled, and energized workforce is what we need in order to take on the structural and existential threats that we're facing in society. Next slide. Thank you. And given these structural and existential challenges, it's no wonder that we see record level burnout across all industries. Healthcare, nevertheless, is notorious for burning out its employees, who are often the first people to give and to put their needs aside to care for others. The pandemic has only intensified burnout among our staff, but there are levers that we can adjust to minimize those feelings of burnout. Over 70% of our participants reported that the CMLC decreased their feelings of burnout. We'd like to believe that the topics that we selected, which provided specific strategies for relationship management and boundary setting, along with the one-on-one support that they received via coaching and by their peers, were just a few ways that the program helped the majority of our participants feel less burned out. Next slide, please. And here are some words directly from our participants, and they explain why the CMLC had a positive impact in our lives. So the first thing that we notice is that the program helped with their self-care practices. We also see that the power of the peer network was a place where they could get best practices and support from each other and also feel less alone in the challenges that they were facing. They also mentioned that the topics that were selected and the structure of their program, combined with on-the-job training that they received, was really relevant for their roles. Next slide. And now we want to hear from you. We've shared a lot about this program, and we're curious to know how this is all landing with you. So if you all can get ready to get brainstorming, you can still leave your video off if you'd like, but just kind of get your hands on your keyboard, on your mouse, because we're going to tap into your expertise and wisdom. Next slide, please. In this brainstorming activity, we're going to use a collaborative tool called Jamboard that acts as a whiteboard and sticky note situation to gather your insights on these 4 questions. So what roles at your organization would benefit from a program like the CMLC? Which CMLC topics are most needed? And what are some other topics that you'd like to see covered? What improvements could you envision for your staff if programs like the CMLC were implemented? What about patient improvements? So you think about the role of PCP and other people as well. And the last one, which is like our dreamy question, what would the healthcare system look like if we invested in programs like the CMLC and in our care managers? And so let me walk through Jamboard real quickly with each of you before we get started. So next slide, please. So this is how we're going to use Jamboard, and there's really only 2 things you need to know when you use it. It's very user-friendly. The first thing you want to know is on the left side, there's a column with a number of icons. You want to pay attention to that 4th icon, which is the sticky note. You just need to click that sticky note, and we'll tell you in a minute about what to do with the sticky note. So left column, sticky note, 4th icon. The other thing that you need to know is how to navigate between the pages, because each of these 4 questions is going to be on a different page. So the top middle of your, so the top center of your screen has the navigation button. There's 3 different ways you can navigate. There's a left arrow, there's a right arrow, and then there's the page, and you can click on the individual pages. So any way that feels comfortable for you can get you in between the pages. Next slide, please. And the other thing is that when you are typing your ideas, and we ask that you put 1 idea per sticky note, every time you're done with one of the ideas, you hit save, and this posts the sticky note onto the digital whiteboard. Once you're done with all of your ideas, you hit cancel, and then you can move on to the next page. And also, I see that Molly Hart asked a question. We're going to get to that at the end after this activity, once we summarize everything. So we'll kind of take all those questions at the end of this. Marie or Christina, would you drop the Jamboard in there? Thank you, Marie. Thank you, Christina. So if you all could click on the Jamboard right now, this will take you to this brainstorming tool. And Selena and myself are going to walk you through each question. You're going to see us looking down because we're going to be timing the questions. So if you see us looking at our phones, that's what we're doing. And then we'll also be organizing your sticky notes based on themes in the background. So if you're putting these sticky notes down and you see that they're moving around, just know that it's Selena or myself who is moving them so we can do a reflection activity with you afterwards. So if everyone can just give us a thumbs up or some other icon to let you know you've accessed Jamboard, and we're going to get started with this activity. And you'll also see that the first page of the Jamboard is an orientation. So if at any point you're on Jamboard and you forget what to do, it explains it to you on that first page. So if everyone can move to the second page, which is what roles at your organization could benefit from a program like the CMLC. So you know what, how about yeah, perfect, awesome. So Marie or Christina, if you could start.
A medical assistants, even dental care staff that could be part of this, care coordination, and then other folks that work in the area of benefits like eligibility, benefits counselors, housing navigators. Jana, can you summarize the next one?
For sure. So it looks like we got some topics around boundary setting and relationships, time management as well. Like all of the topics that we presented were requested. And then kind of looking at other topics we'd like to see offered, definitely cultural competency, how to advocate. I'm wondering too if it's advocacy on a more political or governmental level, or advocate for patients' rights more individually. Health coaching with specific medical topics and lifestyle intervention. It's a great one as well. It was one of the things that we wanted to include, but weren't able to do because of time. We hope to have in the 2.0 version. And then also kind of the acknowledgement that it really depends on roles. And so topics would vary based on who our audience would be as well. And the last piece over here, which is how to have a health in affecting community-wide change in small and rural communities as well. This could be really useful for FQHCs and other health systems within smaller communities, just quite different from the environment that we're in up here. But yeah, thank you.
Great.
Selena.
All right, and then moving to our next question. So on page 4, in terms of improvements, staff improvements, but yeah, across the board, things like less burnout, staff empowerment, satisfaction increasing, coherency among the team, increased confidence. That was a true theme that we were also that thread of what our content was about as well. Higher retention. Yeah, and then patient improvements, right? Because of course, anything that we support staff around, we also want to see the improvements and the, the butterfly effect going outwards to the patients as well. So more patient engagement, things like trust, patients' own confidence in their care, feeling more connected. Yeah, these are great. Thank you. So on to our 4th question.
Last was about what does your dream look like of a healthcare system when we invest in our care managers more. And what we see here is a lot of integrated care. So the melting of silos so that we have people, we acknowledge the more holistic piece of the patient and getting teams to interact with each other. Here's like, these are the workers that are the village of the primary care system. And that by doing a lot of this can lead to a more sustainable workforce, more sustainable practices, leading to less burnout as well, which makes us have a higher retention of our staff. And of course, better quality care, because we're meeting patients and addressing the social determinants and the root of their symptoms, not just the symptoms themselves. So lots of big benefits to our patients and to the system at large and to our workforce if we invest in professional development for them.
Okay. So Maria or Christina, can you go ahead and pull up the slides again? In the few minutes that we have left, we certainly want to bring our time to a close by telling you what we're up to next, or at least thoughts on terms of what we are thinking about for the future. So really amazingly, we are already engaged in cohort number 2 that started in October and ends at the end of December. And we have 27 amazing individuals that are covering a broad sense of team members, like those that you mentioned: dental care assistants and managers, referral specialists, more of our community health workers and advocates, health educators and HIV PrEP navigators, and more. We're also hoping to offer this program as a biannual, about 2 times per year if possible. And that would really help with capturing things like staff turnover, when there are staff transitions, when new employees come on board, as a supplement to existing onboarding practices. And then we're thinking about ways to level up the content of the program, right? Which means essentially that there's more information that can be included, maybe additional sessions to think about. There's a breadth of material out there that we didn't necessarily get to include, and you all named other areas that we could certainly help expand the content and make it more comprehensive. And as we're continuing to develop the content, we're certainly interested in hearing from you. We'd love to engage with you, brainstorm, co-create what works best for the systems as a whole. So let's talk. We have our contact information on the next slide, so feel free to reach out. And we're very open to thinking about how to produce similar programs for yourselves. So with that, Jana, will you close us out?
Yes, thank you all so very much for joining us on your lunch hour and hearing about the CMLC. Molly, we see your question. If you can hang around, we have a couple more minutes where we can go and answer it. We really want to respect everybody's time. And we also know that Marie and Christina have a few words to say, but just thank you so much. And we hope that you can see the value in programs like this. And again, also acknowledge the potential of these incredible people that we had the privilege of being able to work with. So yeah, thank you so much.
And thank you all for being here and for contributing your amazing ideas through our brainstorm. And thank you to CIN, Christina and Marie for helping set this up and helping us take this on.
And for funding us. Thank you so much. We are so grateful for the grant that helped us get this off the ground. Really and truly, thank you. And to our colleagues as well who helped us make this grant happen.
Yeah, yes, thank you so much for helping us set this up.
Goes